Academy of Pediatrics, thank you so much for your time now, for the time reading, for the time that we'll speak with you in your offices, and thank you so much.
Okay, now I take it now you are the initial,
Yes, sir.
what we consider the expert witness. All right, I will give you an extra every couple of minutes. We'll give you a 5-minute intro here, and then we'll have 3-minute inquiries after that, and limit subsequent witnesses to the same 3-minute limitation that we had for the proponents.
Thank you. As a pediatrician and as a member of the Missouri chapter of the American Academy of Pediatrics, we do have concerns about Senate Bill 711. One of those, first and foremost, being is that my charge as a pediatrician is to keep the children in this community as safe and as healthy as possible. And my concerns are that I wouldn't be able to do that to my best ability with Senate Bill 711. With vaccines, we have study after study that has reproduced the knowledge that they are safe and they're effective. As a pediatrician, it is one of the best ways that I can be confident that I can keep the children in this community safe and healthy. With every decision that I make every day, there are risks and benefits to them, and I'm constantly weighing those based on each patient. And to all of the families that have testified before us, I am so sorry for everything that they have gone through. But we also know that vaccines, since 1994, when the Vaccines for Children program was implemented, have saved nearly 1 million lives. And so for that protection that I can bring to the public, to my patients, and to the community as a whole, is very, very important, and is a cornerstone to what we do as pediatricians. We have a few concerns about the vagueness. We talked earlier about the vagueness of the discrimination and how it is stated in the bill. And some of those would be, we've talked about the populations that are most vulnerable, the kiddos that are undergoing chemotherapy, chronic lung disease, chronic kidney disease, all of those kiddos that would be put at risk if they were in a community where our herd immunity dropped, and if they didn't have a safe place to go to school or to go to daycare. And I would question whether that would be discrimination against them if they did not have access to a safe place to go to school or a safe daycare to go to. The other concern that we have as far as the discrimination piece is, as medical providers, when a child comes in seriously ill and we know that they are under-vaccinated for whatever reason, we have to take that into consideration, and oftentimes those kiddos get a more extensive and a more invasive workup. Sometimes it even includes a lumbar puncture, which is having to stick a needle into a child's spine, which is not a decision that I make lightly, but it's one of the only ways that I can diagnose something called meningitis, which would be an infection of the fluid around the spinal cord. That is how that's my best way of, my best chance of saving that child's life. And if they are more likely to have a vaccine preventable illness, I have to be able to rule that out. So for us, we would wonder, the discrimination piece, am I discriminating in when I'm having to view those healthcare decisions differently? And where would that fall within the vagueness of the discrimination within the bill? So as healthcare providers, we have concerns about the vagueness, but most importantly, we have concerns about how we can best protect the children in this community.
Thank you so much for your introduction and your expert testimony. Representative Morris.
Yes, thank you for coming tonight. I appreciate all the doctors coming. But let me ask you some questions.
Absolutely.
Why do you suppose that the federal government, Congress, decided to not hold drug companies liable for vaccines? Why do you think they did that?
I think that it was a different time in 1986, and where they were working, it was trying to use resources and trying to help and find a balance for the families and the families that were affected, as well as helping us to move on and keep moving forward and taking care of children. And we would be happy to have more of an elaborate conversation with you in your office if that would be helpful.
I would, this bill was filed early on,
Yeah.
and you're just now appearing, so this bill was held back and suppressed, and so I guess people thought, hey, I don't have to worry about it, that this bill is here now, and now we're gonna deal with it. One of the things that I did besides owning some pharmacies was I worked for 12 years with a company in Springfield called Biokinetics that does phase 3 and phase 4 drug studies. So I want everyone to know every item that's an over-the-counter medication, every item that you've recommended, other people just go buy at the grocery store or pharmacy, goes through phase 3, phase 4, double-blind, placebo studies, every one. Every prescription drug that you doctors have prescribed and pharmacists have dispensed goes through a double-blind placebo study, okay? I wonder why vaccines never had that type of investigation and study. You have a thought on that?
So it often takes decades for a vaccine to go from the lab to actually being something that I'm able to offer for my patients in clinic. So I know they are extensively studied, and the safety, and they are not brought in and offered to us until we know the safety of them.
So you in your mind just feel like that all these vaccines that you prescribed totally safe?
Yes, sir.
Totally safe. You know, so that's one of the things, you know, and I don't want to, I'm going to ask every doctor different questions, so we're not going to get used to the same questions.
Yeah.
But, you know, totally safe, and we're talking about a lot of people today. This room was standing room only this morning, and a lot of different volunteers that donated, you know, did their time, took their time off and came, and they've got issues. You know, people try to say it's something that happens 1 in a million times. Well, it doesn't. So the next doctor, we're going to talk about what the CD says in 2018, how many different cases we have of deaths and different things. So we're going to have to talk about that, because this is not 1 in a million. This is not in the closet someplace that doesn't happen. I'm not against vaccines. I'm for safe vaccines, and I want people to acknowledge that some vaccines are dangerous, and I think the families have a choice, and that's what I'm fighting for. I think most people will get vaccines.
And I think since the Vaccine for Children program has been implemented, we've prevented over 380 million vaccine preventable infections, and saved, like I said, almost 1 million lives. And so I do think that is worthwhile when I'm having to weigh those risks and benefits.
I'm in room 205, and I'm there almost all the time. So you can find me. Wish you'd have found me sooner. Okay? Thank you.
Thank you. Representative Clemens. Yeah. Representative Clemens and Representative Hill and Representative Walker. 3 minutes.
Just briefly, one of the things that I've noticed from a lot of the testimony is something that kind of speaks to my heart. I've been working on a healthcare issue for 35 years, and that is the very first radioactive waste created by mankind is in my area. The people who live in my area are exposed to ionizing radiation everywhere they go. It's around our environment. A lot of fallouts from ionizing radiation exposure happen, including autoimmune problems and immunosuppression. And exposure to you today can show up in your grandchildren, which is another fun thing to play with. So one of the things I keep hearing about is family history and autoimmune issues. And I'm wondering about practice, and you may not be able to speak to this, but practice in terms of your line of work and those inquiries to family history and the potential risk. Because if we're dealing with an immunization, I know how the deal works. You supposedly hit them with a piece of it that isn't going to override their system and make them ready with the antibodies. But if somebody's got an issue whatsoever, that could run into really big long-term problems. It could certainly run into just getting a positive for exposure to disease. So I'm done with my inquiry, but I'd love to have the answer. Thank you.
Absolutely. So you're speaking to the difference between live and our non-live vaccines. Absolutely. And somebody earlier today pointed out the difference in some of our chronic kiddos can actually get vaccines. They can. They're not contraindicated except for the live vaccines, but they're still at risk when they're put into a population where we don't have what we know to be the necessary percentage for herd immunity. But I understand what you're saying, so it's the live vaccines, and those are our specific.
Actually, my question is there practice for solid inquiry to family history and the risks to the patient? That's what I'm looking for, is what kind of safeguards are a part of the professional criteria for your line of work?
I understand, yes, sir. So every time we have a new patient, whether they're a newborn coming to our clinic or if they're transferring their care, we do a more extensive family history and get that information from the families, yes.
Representative Hill.
Thank you for coming tonight. You're still in practice?
Yes, sir.
Correct. Hearing some of the stories tonight, really it's not so much against the vaccine and the validity of getting vaccines. It's more about how folks are treated. So my question to you is, do you condone a physician that refuses to care for someone that may have a different opinion on whether or not a vaccine is good for their child?
I think that is a very difficult question
Well, I
among
would
the
like you to
providers.
answer.
No, absolutely. It is not a discussion that we take lightly amongst the healthcare provider community. The AAP, the American Academy of Pediatrics, has said that they do allow for physicians to ultimately make the decision. If you've been able to, if you've tried to sit down with families it's not something that we want to do, but if at the foundation of the relationship that I have with a patient, if this is one of the most important things I can do as a pediatrician and we can't find common ground here, it can be very difficult. So that's what the AAP has gone to the point of saying, if that is a point that we get to, but more importantly, I have to look at my practice as a whole, and as all of the patients that will be coming into my practice, if they are a part of that vulnerable population who would be more at risk, if we were in Washington or New York State right now, and a mix amongst the measles outbreak, would
So wait a
would they
minute,
still be willing to come?
let me get this right. So you're saying that you have to consider the health of your other patients?
Yes, sir.
Okay, so when someone walks into your place that has a contagious virus, I mean, are you gonna tell them not to come in because they could give it to other patients in the other rooms?
No,
Okay.
they're, right.
So let's really be sincere here. I mean, do you condone telling a parent that you're not welcome here because I don't agree with your position on vaccines? Do you condone that or not?
I think ultimately I have to protect my population of patients.
Wow, that scares me quite a bit because somebody mentioned, and I'm not going to say who, somebody mentioned that there's a Hippocratic oath that is not for a room full of people, it's between you and your patient, right? I mean, does that still hold true today? I mean, you throwing that out the window?
It absolutely does not, but at the crux of it is, I believe that that's the best way that I can take care of
man.
that child.
Okay. Well, just so you know, I got some of this. I mean, it's not to the extent of some of these folks had, but I got some of this when I was a young parent. I didn't know, a thing about vaccines. But whenever I questioned a vaccine, I got laughed at by a physician. And it made me feel awful. And I wasn't going to tell this story because I really didn't want to get into it. I went to a different doctor. And then that doctor was the one that wanted to push the chickenpox vaccine on my child. And I thought, well, he's already had the chickenpox. Well, sorry, if you want to send your kiddo to school, you're going to have to get the chickenpox vaccine. I had to go to a third doctor. And then that's whenever the doctor was like, you know what? I'll just say you got the vaccine. Now I'm going to go to that doctor all day long because, I mean, that's looking after my child. So, I mean, you got to understand that these folks came here for a reason, and it's not for the collective well-being of your practice. It's because they want a physician that's going to take care of their child. So I'm kind of disappointed in your answer, honestly.
I'm sorry about your experience.
Representative Walker.
Thank you, Mr. Chair. I'm gonna give this to you. It's good. You should check it out.
3 minutes.
I've got several. Thank you, Mr. Chair. I'll be quick. Okay, so thank you so much for coming. Thank you for your patience. I really do appreciate it, and I also appreciate the fact that we now have the opportunity to hear from a clinician and someone who has a little bit of a technical background in what we're talking about. So. Actually, I want to start just really quickly, and we've got 3 minutes. And so, whether or not you can, let me tell you, whether or not you can answer these right now versus submitting written testimony, I would, and I imagine that this question I'm going to ask probably deserves to be submitted via, the answer should be submitted via written testimony. But I'd love to hear just thoughts about why randomized control trials for vaccinations might not be the gold standard by which we should measure the effectiveness of vaccinations versus things like, you know, new drugs that are being created and trying to determine their efficacy or effectiveness. If you could submit that just in written testimony as to why